Hello, everyone, and welcome to today's Ask an Expert. I'm here with Rammina, who I met at a Power of 10 festival at Sheffield Hallam University with Another Way. Hello, Rammina.
Hi, thank you for having me.
You're very welcome. Would you like to introduce yourself and tell us a little bit about your background and how you got to be where you are now?
Yeah, absolutely. I'm Rammina Yassaie. I'm a doctor, and initially I trained in pediatrics, so working as a children's doctor, and then moved into family medicine in general practice. But when I started medical school, when I started working as a doctor, I thought I'd go around saving lives and making sure that everyone was healthy. But I realized very quickly that what we do in medicine is we just kind of stop people from getting sicker once they're already sick. What I really wanted to do was kind of think about what was leading people to get ill in the first place. And so soon after, I realized that health doesn't start with doctors, nurses, operations, medicines. It starts with having access to clean air, nutritious food, comfortable temperatures to live on, healthy water, comfortable shelter as well, and peace on earth. And if we don't have those things, those are the very foundations of our health, and we don't have health. So I moved more from the clinical space into educating people on the links between health and climate, as I feel like I can have a bit more impact in that route. And that's one of my main roles now is to educate health professionals and anyone interested in health about how we can join the dots between healthy people and a healthy planet.
Yeah, and I mean, that's my second question was coming on to about, what is your role in climate action? I love how you've sort of, you are presented with this patient, but you're looking back at their history and their sort of, I know we talked a lot about nature connectedness. We were really lucky that we were in Sheffield, which is, one of the spaces that's got a lot of trees. And we talked about, where people go to hospital and a lot of it depends on what they are looking out on as well.
Yeah.
So sort of what is your role in climate action through that health lens?
My role, I think I have lots, I see myself as having lots of roles in this. One of them is as an educator, like I've mentioned, around both speaking to health professionals and future health professionals so that they can really recognize that you can't have healthy people on a sick planet. And I think once people recognize that, they realize actually that climate action, if you look at it through the health lens, it often makes you sort of more convinced about the urgency of action. But I also see myself as a patient educator. So, people that don't even want to, be health professionals, they still care about their own health. They still want to learn about how to make sure that their friends and their family and their communities are healthy. So I think that education comes not just through future health professionals, but through that patient and public education as well. And I would also probably say that I don't shy away from the label of activist either. And I feel that we're all active in this work, and activism can mean different things to different people. But to me, I just see it as being a champion for health advocacy. And I don't think you can really be an advocate for health unless you're also an advocate for planetary health, because those two things are really interdependent. And you can't have healthy people on a sick planet. So my role ultimately is just around education around that through students, through other colleagues, through clinicians, but also general public education through some activism streams as well.
Yeah. And going on to my third question, what I like about you is if you've got all these roles, from being a doctor, like you say, you started off in pediatrics, you've gone into that education side, you're working with students, you're working with college, but you've got that thread going through with that healthy people, healthy planet. And I just think that's so wonderful, really. I find that like because I have two roles, it's that wonderful balance where you can share that wealth and your outlook on, that, if you want to live on you want to be a healthy person, you need to look after our planet and make sure that's healthy, and then the planet can look after you. And I think that's so important. So now you've gone into some of the education side of it. What has the response been from um, students, and then what has the response been from your colleagues in both sectors?
Yeah, so I think in terms of colleagues, I think one of the things I've noticed about my educator colleagues is that they all care about this. I think everybody cares about this. Like once you actually get them, usually when I talk about this, I ask people to put their hands up if they care about their health, if they care about the health of their friends and their family, if they care about the health of their loved ones. And everyone has their hands up at this point. And I tend to get them to look around the room and say, look, we all care. So then we can now let's talk about why this matters and why this links to the things we care about. So my sort of general summary is that people do care. And with my colleagues, they do care, educator colleagues, but they often feel nervous about how to explain things because ultimately they weren't taught this. When I was a medical
Yeah.
student, I wasn't taught any of this. So who taught me? No one. I taught myself. So there's some kind of hesitation and nervousness around some of my colleagues in educating students about this. But what I've learned is that there's something around co-created learning, like, we can all learn together. So we've got some students who are really knowledgeable about some of this stuff as well, and they really care as well. And actually just kind of allowing us to kind of not always have sort of this all-knowing teacher, but more of a facilitated space where we can all learn about this because it is a really complex challenge and it matters to all of us. So you don't need some kind of sort of expert teacher to come in and hold that space. You just need someone that cares to hold
Yeah.
the space for people to share what they know. So I felt like that's been a helpful way of bringing people on board. And one thing I have been really impressed by is actually the enthusiasm from our students when they learn about this, particularly those that I teach a lot of people that are training to be varied healthcare professionals,
Mm.
and they can all join the dots between how this matters for their own role. And we run sort of student competitions to get them to write around what climate action means to them and the absolute passion in which they talk about it and they recognize how strongly this links to health really shines through. And I think doing things like competitions is also really helpful because it creates a bit of a positive energy with a prize. And rather than sometimes this work can feel a bit doom and gloom, but if we try and kind of give some positive energy, it kind of gives people something hopeful to work towards as well. So I think generally, once you move through a bit of anxiety and nervousness and find an angle which people can find interesting and inspiring, then it tends to land well. And that's what I try to do. I love trying different methods to get people inspired and interested in this work. And I think once you've got that, once you've hooked them in, then they're almost like connected now. They're connected to the movement and they want to know more. And that seems
Yeah.
to work.
Yeah, yeah, yeah. You do get that. You want to know more. You want to know what else you can do, how else you can benefit yourself, benefit the others around you, benefit our planet. And I found, obviously, at the Power of 10 Festival, it was younger students than university, but what really inspired me was their passion and their aspirations about the kind of careers they want to go in. So in the part I was doing, we were talking about green careers and how other careers are linked. And I know when I came to listen to you, you sort of said the career I'm in, you don't often think of as, the NHS and using, obviously a lot of things have to be sterile, they have to be single use. And you said, but there's this other side of it that does help benefit health. And it was just, I just found it so interesting. And the students there were coming and talking to you about it. I know they were very interested in the things like the clean air, especially
Mhm.
around like schools and colleges, so I say, and about having school zones where, we don't have idling, so pupils on the school run from our youngest children up to, and the teenagers and the sixth formers, are having a route to school with clean air and, nature connectedness. So I think you really inspired a lot of young people there as well through your talk. Yeah, it was really, really interesting.
Yeah, I think because a lot of them came up to me after my talk about and kind of asked more questions about it. And I think what I found was really helpful is that even if they weren't necessarily interested in a career in
Mm,
healthcare, they could see why the links to health were really important, and they could
yeah.
see that having clean air is really important for their own lung development. They
Mm,
could see that having limiting risks from flooding from climate change is really important for all of our health, for our mental health, for our
mm,
physical health. They could see the risks around heat waves. And even when I asked them, when it's really hot, how do you feel? When you feel uncomfortably hot, what are the symptoms you have? Like we all can resonate with this. We know what it's like to feel really uncomfortably hot. We can imagine what it would be like to experience flooding, even if we've never experienced those things. And we can sense that these things would be really bad for our health. And the evidence shows that to be true. And I was really impressed by the number of young people that kind
mm.
of could speak passionately about it, even if they perhaps hadn't made those connections before.
Yeah.
Which I think just shows people do care about health, and it's just trying to put the climate action through that health lens that makes us
Absolutely.
all advocates in the same way.
Yeah, absolutely brilliant. Yeah, really, yeah, I really enjoyed that day. So what is the future for you then? Because I would say to you, you're such a busy person.
Yeah, and I think, I mean, at the moment, I'm really happy doing what I'm doing now
Mhm.
around the education. And I think one of the joys in what I do now is I feel like I've got this nice portfolio career where I do varied things, where I educate, where I have some clinical aspects to my role. But I'm also do some research, and I, again, like I said, see myself as an activist. So I find varied campaigns to get involved with as well, particularly through health, because there's a lot of health organisations that look at climate and health together, and there's lots of routes to get involved there. I suppose in terms of the future, one of the things I'm really interested in is thinking about how do we build community resilience, more effective resilience in our communities, and how do we create healthier communities that can support one another when things get tough. And we saw that in COVID, that was a big public health crisis.
Yeah,
And actually, just the stronger our communities were, the better we were able to respond to that and support each other and help people that were isolating and all of those things. So one of the things I am really interested in is thinking about what can we do to strengthen those communities so that when things do get tricky, we are supporting each other in each other's health, and kind of moving to a more kind of dependent
yeah,
sort of community where we help each other out and see each other as, each other's aides in some of these
yeah,
struggles. So
yeah,
that's one of the things I'm
yeah.
looking
You
at.
draw on that nature connectedness there of like that like ecosystem of people and place.
Yeah.
And I love how you started with what you do brings you joy. And I think that's so important. Yeah. So finally, just before we finish off, what advice would you give either, well, anyone really about that healthy planet and healthy people connection?
I would say, I think generally what I experience with the climate movement is that some of the language is either really complex or people don't care about it. Like if you talk about net zero, it's quite boring and no one really understands what you're talking about. But if you talk about health, people understand that. If you talk about having clean air that doesn't make you cough and make you feel ill, people understand that. If you talk about heat that isn't, really uncomfortable, and you talk about not wanting to experience things that are going to make us unwell, like sort of dirty water and things like that, polluted water. All of these things people understand, and it's much easier to talk about. So I just think, and even if it isn't health, if health isn't the thing you want to talk about, finding a narrative that actually connects with everyone, even if they're not interested in the planet in itself,
Mm,
but actually a lot of people are interested in health. Or they're at least interested in the health of their children or their parents or their community. So I think just finding language that people connect with is really important, and not always sort of using the words like net zero or sustainability, which often doesn't really mean anything on a human level.
mm,
So I just talk about people and planet. That's literally
yeah,
what I say. The kind of like basic words, like you can't have healthy people on a sick planet. And that would be my advice. And I suppose drawing on what you've said there around making it fun, and, like I'm perfectly capable of living a hilarious life whilst doing all of this work. And I think there's something around not becoming the fun police and trying to, find a way that it's joyful, because that's going to sustain us in the work. If it's joyful, we feel like we're quite good at it. And ultimately, if we can get paid for it, then that's a bonus as well. So yeah, I would say, talk about it in a way that makes people understand you, and talk about it in a way that makes people think it's fun.
yeah,
And that to me is the winning trick there.
yeah, definitely. I think, like you said, you getting that narrative with someone, you will be able to start a conversation because, like you said, no one wants to feel too hot.
No.
One wants to be worried about flooding and the damage that flooding can cause, and then the health risks from that, plus the financial loss, things like that. Um, no one wants to be breathing in air that's polluting our lungs. So, and like you say, it might be that they're thinking about their children on the school room. It might be that they're thinking about their elderly relatives. They will find that relationship. And like you say, having that narrative means people are talking and, like you say, finding out more. And some people do kind of want to back off because they think, well, I don't, does net zero mean this? Does it mean no? Does it mean None does it mean a balance. Whereas that you can talk and talk through and look at the solutions, like you say, connect the people and the places and our planet, and come up with some solutions that will benefit them and our planet as well.
Yeah,
So
definitely.
thank you. Thank you so much for joining us today. And we look forward to hopefully our paths crossing again.
Thank you very much.